Hi, I'm Dr. Dagny Zhu, and I'm a cornea, cataract, and refractive surgeon. I practice as medical director and owner of Envision Eye Centers in Rowland Heights, California. I decided to become an ophthalmologist because I believe that being able to see the world around us helps to experience life in a powerful way. I feel privileged as a physician being able to help better the lives of patients by helping them see better. This, of course, would not be possible without the use of innovative technology that enables physicians like myself to give our patients the best vision possible. With technological innovation, however, comes training and education, and oftentimes is accompanied by a high learning curve. I work in a busy refractive practice, and being able to maximize efficiency while delivering a positive patient experience is our single most important priority. I'm happy to share with you today the many tips, tricks, and pearls that we've learned along the way on how we are able to achieve our objective and help our patients achieve the best outcomes. And again, it starts with education. Objectives. In this lesson, we are going to overview modern technology advancements in cataract surgery that enable surgeons like myself to deliver excellent visual outcomes for our patients. By the end of this lesson, you will be well versed on the various intraocular lens options, the importance of femtosecond lasers, and also how data analytics support our decision-making process before and during surgery to make adjustments intraoperatively. Here are the objectives of this lesson. Number 1, obtain a comprehensive understanding of the various intraocular lens IOL options. Number 2, review the use of technology such as femtosecond laser to enhance the cataract experience and improve our outcomes. Number 3, review how data analytics continue to play an important and ever-growing role in surgery planning and intraoperative data analysis. Cataract overview. As you may know, cataract surgery itself is relatively straightforward. The surgeon removes the natural lens, which over time has become cloudy, and replaces it with an artificial intraocular lens implant. The surgery itself only lasts a few minutes. The most important part of the procedure actually happens before the surgery itself. Number 1, it's important to identify the best intraocular lens for each patient based on their personality type, occupation, lifestyle, as well as the overall health of their eye. The second most important thing is for the surgeon to accurately hit the correct target so that the patient ends up with the least amount of residual prescription or refractive error and enjoys the best vision possible. We will discuss these 2 points in greater detail as we review the various intraocular lens categories individually, as well as how to best match each patient with the best IOL. Some of the IOL platforms we will review in this lesson include monofocal lens implants, presbyopia-correcting IOLs, including multifocal lenses, extended depth of focus lenses, accommodating lenses, light adjustable lenses, and finally, we will also review astigmatism correcting lenses. Let's start with the most basic of lenses, the monofocal lens platform. This, as its name suggests, is the lens that corrects only one distance. Traditionally, surgeons use this lens to correct a patient's distance vision. The limitations with being able to correct only for distance is that the patient will still need to use glasses for activities such as working on their computer or laptop and for reading up close. We call this intermediate and near vision. Alternatively, the surgeon can also, in some instances, aim for near vision for patients who prefer to see up close without glasses. Conversely, in this situation, the patient will still need to wear glasses for intermediate and distance activities, such as working on a laptop or computer and driving. In either case, the patient will need to wear glasses. To get around the limitations of a monofocal lens, a common approach is to employ monovision, often referred to as blended vision, in which the surgeon aims for distance in one eye, typically the dominant eye, and near for the other eye. In order for this approach to be successful, typically these patients will have demonstrated tolerance to monovision in the past using contact lenses. Some patients just don't tolerate monovision because they always feel a little bit blurry at every distance, so demonstrating tolerability helps improve post-surgical outcomes. Although monofocal lens technology has improved vastly over the last several years, you can see that there are still limitations in getting patients to be more spectacle independent. When explaining the features and benefits of the various intraocular lens options, patient counselors and surgery coordinators need to be cognizant of being able to set lower expectations and help patients understand that they will still need to use glasses for a variety of situations, including at distance. Why at distance, you might ask? Well, because although technology has again improved vastly over the years, a surgeon cannot guarantee that they will hit the target. Each patient's anatomy and ocular health is different. As a result, outcomes can never be 100% predicted. On the positive side, the monofocal lens, being the most basic option, is also the only one that is entirely covered by insurance. For patients who desire more spectacle independence because they're younger or live a more active lifestyle, a presbyopia correcting lens may be a better option. And there's a number of different platforms available today. Let's take a look. The multifocal IOL gives the greatest range of vision and greatest freedom from glasses and contact lenses. Previously, there were only bifocal multifocal lenses available, and they corrected only near and distance. But recently, in 2019, the FDA approved the first trifocal IOL, the PanOptix, which corrects distance, intermediate, and near. Another multifocal IOL that gives a full range of vision is the Synergy lens. With both of these IOLs, patients typically do not need to use glasses for any activity. But even so, it is important to disclose that there may be some occasions where the patient will still need to use reading glasses to see up close, especially for fine print or under dim lighting conditions, as is often the case at some restaurants where the print on the menu is tiny and the lighting is very low. Counseling patients on having realistic expectations, even with multifocal lenses, will help patients' post-operative experience. Now, there's no such thing as a perfect lens. One of the downsides of the multifocal IOL is related to the quality of vision. You see, with the multifocal IOL, there are concentric rings or circles etched on the surface of the lens. Those rings bend and focus light onto the retina, enabling various focal points to converge and form images, thus providing a greater range of vision. While this technology is advanced, the downside is that the vision at each of those focal points can be a little blurry and a little bit lower in contrast compared to a monofocal IOL, which again focuses at only one focal point. Additionally, those same concentric rings that split light and allow greater range of vision can also cause bothersome nighttime symptoms like halos and glare around lights. Multifocal IOLs are a great option for some patients, but they can also be limiting in the quality of vision. Patients who select this lens need to be realistic and be willing to sacrifice a little bit of quality of vision for a greater range of vision and freedom from glasses. In terms of patient selection for a multifocal lens, I typically avoid this lens in patients who have very high visual expectations and require excellent distance vision, especially at night. These patients can include pilots and truck drivers. The best personality type for a multifocal lens are patients who have pretty easygoing personalities and can understand the trade-offs with this presbyopia correcting lens technology. Finally, in order to deliver great results, the eye itself must be free of any pathology. Some reasons why surgeons might rule out a patient as a multifocal candidate can include severe and chronic dry eye disease, diseases of the retina and/or the optic nerve, untreatable astigmatism, as well as complex irregularities of the cornea, medically referred to as higher order aberrations or HOAs. A multifocal lens only works in an eye that is healthy. It's extremely important for all presbyopia correcting lens planning, particularly for multifocals, to perform comprehensive screening before surgery, including performing a comprehensive dilated eye exam, as well as OCT imaging of the macula and screening for any dry eye disease. It is very important for the eye care team to gather accurate eye measurements and diagnostic tests in order to help surgeons evaluate patient candidacy for a multifocal lens. Now that we've discussed monofocal lenses, those having a single focal point, and multifocal lenses, those having multiple focal points, let's now take a look at a third lens category, the extended depth of focus IOL, simply referred to as EDOF. Examples of these include the Vivity and the Symphony lens. The EDOF lens, as the name implies, features an elongated focal point. The lens design helps extend the depth of range of focus of an image, providing patients a little more spectacle independence than with a traditional monofocal lens. Patients who are good candidates for this lens will have good unaided distance vision, intermediate vision, as well as functional near vision, meaning that patients will still need to use reading glasses to see smaller font on their smartphones and to read for longer periods of time up close. This lens is a good in-between option choice for patients who may not be candidates for multifocal lenses because of their vision expectations, occupation, lifestyle, and/or pathology of the eye. Moreover, EDOF lenses generally cause less halos and glare than a multifocal and tend to be a little bit more forgiving in patients who have mild underlying pathology such as mild or manageable dry eye disease or a history of refractive surgery. This lens category continues to see improvements to provide patients with a wider range of vision without glasses. And while some patients may not be good candidates for this lens, for those patients that have reasonable expectations and are properly counseled, the EDOF lens is a good option. There's only one lens option in this category, and that is the Crystal lens, manufactured by Bausch & Lomb. Crystal lens is a single-focus IOL designed to mimic the movement of the natural lens by changing its shape to effectively focus light onto the retina. Tiny flexible hinges allow the crystal lens to accommodate within the eye by using the focusing muscles of the eye, known as the ciliary muscles, to flex and relax in order to provide a wider range of vision without glasses. In essence, when the ciliary muscles are relaxed, the patient can see distant objects, and then when the muscles contract, the lens accommodates and moves forward to focus on intermediate and near objects. Because crystal lens doesn't have circles or rings etched onto the surface of the lens to focus power, it is not commonly associated with halos and glare, and the quality of vision is excellent. Crystal lens makes a great lens option for a wider range of patients, including patients who've had prior LASIK surgery and patients who are not candidates for multifocal lenses. However, a downside to crystal lens is that near vision can be limiting for some patients. When counseling a crystal lens patient, it is important to inform patients that while crystal lens provides excellent quality of vision, and patients may very well be able to perform the vast majority of activities without glasses, they may still need to use glasses for reading and small print. The light adjustable lens. The newest category of lenses in the presbyopia correcting space is the light adjustable IOL. This lens, manufactured by RxSight, features innovative technology that helps doctors target with astonishing precision the patient's desired vision goals after surgery. This technology is revolutionary because for the first time in the US, we can essentially customize a patient's vision after surgery. The company's proprietary technology employs a lens material that is photoreactive, meaning it changes as it's exposed to non-invasive light treatments in order to achieve the desired vision goals of the patient. Where many other presbyopia correcting IOLs are limiting in the quality and quantity of vision and can be restrictive as to who is or is not a good candidate, the light adjustable lens offers a much wider range of patients who can benefit from this product. Sometimes patients have less predictable lens calculations, such as patients who've had LASIK, PRK, or RK. And this lens is ideal for those patients because when we customize the lens power after surgery, we can fine-tune it until it is near perfect for that patient, despite their unpredictable IOL calculations. The light adjustable lens is also a great option for patients who are a little bit more meticulous and type A. They are perfectionists and want to hit that final refractive outcome to the T. Can you think of a patient you recently met who fits this profile? As a surgeon, I'm ecstatic to be able to work with a platform that is flexible and allows me to deliver great outcomes with incredible precision. I often employ mini monovision to give patients great distance and a little more near vision. And the light adjustable lens is a great lens that helps me accomplish this with incredible accuracy and greater extended depth of focus than with a traditional monofocal IOL. Furthermore, because we can better target desired vision goals, a huge benefit to patients and doctors alike is that the incidence of having to undergo additional surgery such as a lens exchange or laser vision correction is greatly diminished with this lens. However, there's still no such thing as a perfect lens, and the light adjustable lens is no exception. There are a couple of downsides to this technology. Number one, patients who choose this lens will have to be counseled on the need to use special UV blocking sunglasses after surgery for a few weeks until they have completed their light treatments and are satisfied with their vision goals. Why? Well, ambient light can potentially cause undesirable changes to the IOL before the final light treatment is completed. Number two, light adjustments are performed at specific time intervals, and patients will have to come back for several post-operative light treatment adjustments, usually 2 to 3 or more additional appointments compared to a different presbyopia-correcting lens. And lastly, the patient will have to be dilated at each of these follow-up appointments, which means that outside the unpleasantness of being dilated, their visits may be long, or they may need to be driven to and from their appointments. Open communication and disclosure of what to expect post-operatively is crucial to the success of this lens. If a patient doesn't mind being dilated, having to come back for a couple extra visits, and having to wear UV protective glasses, this lens can deliver outstanding outcomes for the vast majority of patients. Astigmatism-correcting IOLs. Finally, let's review astigmatism-correcting IOLs, sometimes called toric IOLs. This category of lenses are available in both monofocal and presbyopia-correcting options, including multifocal, EDOF, accommodative, and light-adjustable lenses. Let's first establish the fact that the objective of toric lenses is to correct a patient's astigmatism. Why? Because by correcting the patient's astigmatism, we can provide the best visual outcome at any distance. If you recall, astigmatism simply describes an irregularly shaped cornea causing the patient's vision to be blurry at all distances, therefore decreasing their quality of vision. If the patient's amount of astigmatism is mild to moderate, it can be corrected with limbal relaxing incisions in the cornea, which can be done with the femtosecond laser or manually at the time of cataract surgery. However, data indicates that correcting astigmatism with an intraocular lens is better long-term for the patient. That said, for patients who have astigmatism, they should consider a toric intraocular lens. For patients who have astigmatism, desire spectacle independence, and are candidates for a presbyopia-correcting IOL, they should consider an advanced technology toric lens option. Now, let's talk about some of the technologies that assist us with achieving the best outcomes possible for our premium surgery candidates. Femtosecond laser. The femtosecond laser was first introduced in 2011 to support cataract surgery. Gradually, it has become a very important piece of technology that aids in performing a number of cataract steps with greater precision and often safety. There are 3 primary benefits to implementing the use of the femtosecond laser at the time of cataract surgery. First, it helps in creating the capsulotomy, or the opening of the capsular bag, at the perfect size and shape. This step allows the surgeon to more easily access the cataract to then extract it using ultrasound and suction energy. Second, the femtosecond laser helps to break up or fragment the cataract so that the surgeon can use less ultrasound energy and be able to gently extract the cataract without damaging or causing swelling to the patient's cornea. And third, if a patient has moderate corneal astigmatism, femtosecond laser can create precise limbal relaxing incisions to help the patient's quality of vision after surgery. Although cataract surgery is safer than ever, it is still microsurgery. And the longer we stay in the eye using ultrasound energy, the more trauma we can cause the eye and the greater risk of swelling, edema, and possible complications. The femtosecond laser seamlessly and with laser precision supports some of the major steps of the cataract process, creating the opening of the capsular bag, fragmenting the cataract, and correcting moderate astigmatism. Femtosecond laser technology is an extremely important adjunct piece of technology that the surgeon can use. However, it is not covered by insurance or Medicare. Presenting this option to all patients is good practice, particularly for patients with a high degree of expectations and who may be prepared to pay out of pocket for more precise outcomes. Data analytics. Finally, there is a lot of data analysis that takes place before and during surgery in order to deliver excellent results for patients. We implement the use of modern tools available to us today in an effort to evaluate the patient's ocular health, observe their anatomy, and then predict what their best refractive outcome will be. Among the many available options, we commonly use the patient's preoperative biometry and topography scans to predict the IOL power. In some cases, we also use what is known as intraoperative aberrometry, or AURA, as another reference point. AURA is a device that measures the eye during surgery just after cataract removal, giving the surgeon one more piece of information to help choose the proper lens power for that patient's eye. This is especially important in patients who have less predictable IOL calculations, including those who have had a history of LASIK, PRK, or RK. AURA is particularly useful when correcting for astigmatism, as the information it provides can help the surgeon choose the correct toric lens power, as well as guide the surgeon in rotating the toric lens to best correct astigmatism. Another newer innovation is the Callisto system by Zeiss. Similar to AURA, Callisto helps guide toric IOL rotation during surgery in order to best position the lens to correct astigmatism to the fullest amount possible. Now that you know the importance of pre-surgery planning utilizing the various tools available, the next frontier is readily accessible information and artificial technology to help in the surgery planning process. Currently, industry manufacturers are working diligently on creating web-based solutions that can help integrate in-office surgery planning with intraoperative data access. Zeiss is the first manufacturer to introduce a product in this category, and it's called Veracity. This software product is a workflow tool that integrates with EMR and operating room technologies to enable doctors to have complete patient information in one place in order to easily make decisions. At the time of this recording, Alcon and Bausch & Lomb are also in the near release of their version of data integration solutions. So in conclusion, it's extremely important for the staff to support the doctor in gathering the necessary information to make the best diagnosis and plan for surgery for each patient. It's also important for the staff to further educate patients and help them feel safe and confident in trusting the treatment recommendations suggested by their doctor. The staff is also there to support the patient as they move forward with treatment recommendation. And they're also essential in communicating with the patient, the pharmacy, the ASC, insurance companies, the referring doctor, and other parties in order to ensure a smooth process for the patient. In my practice, I find that the patient counselors are really the patient's advocate because they spend the most amount of time with the patients throughout the entire process, and so they have the best understanding of the patient's needs and desires. As a team, we can help guide patients into making educated decisions that fit their lifestyle and desired quality of life. As you progress in your career, always remember that technology innovation will continue to push the envelope of what can be achieved and how much better vision outcomes will continue to improve over time. And as technology improves, so will the education of eye care teams. Embrace learning, be curious, and ask lots of questions. Your surgeon, your colleagues, and your patients are reliant upon you having a strong knowledge base.